Happy September, guys! I actually had a video planned for yesterday, September 1st, and life got a little hectic as it tends to do, and the baby didn't sleep very well, so I didn't get to actually record to put this out yesterday. But it's still September, and I still wanted to do the video. So, as I've mentioned before, September is National PCOS Awareness Month. And as I've also mentioned before, I have PCOS, polycystic ovarian syndrome, which makes me 1 in 10 women. PCOS is a genetic, hormone, metabolic, and reproductive disorder. And sadly, it is the leading cause in female infertility. Now, this disorder can lead to other severe conditions such as anxiety and depression and obesity, endometrial cancer, type 2 diabetes, liver disease, and cardiovascular disease. So it's definitely not a small condition. About 50% of women with PCOS will go on to develop type 2 diabetes, which is something I'm scared about. And that's before the age of 40. Women with PCOS are 3 times more likely to develop endometrial cancer. So that is also very scary as a woman with PCOS. I don't like knowing that I'm at a 3 times higher risk than an average woman. Some of the possible symptoms with PCOS include irregular periods, excess facial and body hair. So actually, because of testosterone levels, I could grow a beard. Not me personally, I haven't had problems. I'm lucky. I feel like my testosterone levels are lower, but I actually do know some women with PCOS that do have to shave. They're doing construction on my road. But I do know some women who have to shave because they grow facial hair. Some of them own it and some of them hate it. I know me personally, I would hate it. It would be really hard, and I admire the women who just own it and say, this is who I am. Other symptoms include severe acne. The big one is obviously the ovarian cysts. It's not a visual one, but it can cause severe abdominal pain, and they can rupture, and you can actually lose an ovary because of it. Obviously making it hard to conceive when it's already hard enough. There's also insulin resistance and trouble losing weight or weight gain, and infertility, which was my biggest fear. I was afraid that I was going to be unable to have children. There is no cure for polycystic ovarian syndrome, which is why that is the charity that I'm going to be donating to this month, is a PCOS awareness charity. I have briefly told my story before about trying for Isabella, and it took us 11 months plus 1 miscarriage in January of 2019. We were on Clomid, which is a pill that you take once a day for a few days so that you can ovulate. Because a big thing with PCOS is you could or could not ovulate. You know, it completely throws off most women's cycles. So then, even if you miss your period, you never know for sure if that means anything, because I've gone 3-4 months without a period just because of this condition. So you have to test every single month. It was very exhausting trying for her. She's very much worth it, but it was tiring. So I consider myself one of the extremely lucky ones with PCOS because I have 2 beautiful children, and I know some women in my support groups that they never get lucky enough. I know some women who have been trying for 14 years and still haven't gotten that positive test. I know some women who have suffered miscarriage after miscarriage and just heartbreak after heartbreak. So I definitely consider myself lucky, even though we did lose 1 baby, and even though it took us a while to conceive Isabella, I'm still so fortunate to have them that I'll never take that for granted. So I just wanted to shout out all my sisters out there. I wanted to tell you that I know what you're going through, even if I don't know the extent. I am here for you. I see you, and I love you. And I want every single one of you to continue fighting like a girl. So that's all for today's video. If you enjoy it, you like the message that I am sending out there, I would greatly appreciate a like on this video, a comment if you know somebody who's dealing with PCOS, or you are somebody who's dealing with PCOS. If you've lost a child so you can relate, or you have a different disease that you're dealing with, any possible comment, I would greatly appreciate it. And of course, subscribe for future videos and click that bell for notifications for when myself or the fam upload a video. I love you guys.